Okay, everyone. Good afternoon. If you are looking for the Small and Rural Hospital Relief Program information webinar, you are in the right place. I will kick things off just with a little bit of housekeeping first thing. In coordination with the AIA California, you'll be able to earn one AIA continuing education unit by attending the entire presentation. You should note that multiple staff members from one office should register individually and to receive separate logins. If you do not register as yourself and attend the webinar under your own login, we will not be able to report your attendance to AIA. A list of registered attendees who logged in and attended the entire presentation will be sent to AIA following the webinar. If you have questions regarding continuing education units, please contact AIA California. Please note that you will not receive an attendance certificate from HCAI. All right, with that out of the way, I will kick things off. So thanks for joining to learn more about the Small and Rural Hospital Relief Program. Today's presenters from the Department of Healthcare Access and Information are myself. My name is JP Marion. I am the Deputy Director of the Office of Health Facility Loan Insurance within HCAI. Some of you may know our flagship program, which is the Cal Mortgage Loan Insurance Program that helps not-for-profit healthcare facilities find financing for construction projects. So we have partnered with the Office of Statewide Hospital Planning and Development for this Small and Rural Hospital Relief Program. And from OSHPD's Seismic Compliance Unit today, we have Ali Sumer, who is a supervisor within OSHPD, and also Carl Schauerman, who is a senior policy advisor within OSHPD. So what is the Small and Rural Hospital Relief Program? So this was created under legislation, Senate Bill 395 in 2021 from Senator Caballero, and it is detailed in Health and Safety Code section 130075 through 79. And what this is there is an excise tax collected on the sale of electronic cigarette products from retail sales of these products throughout California. Of this sales tax that is collected, 10% comes to this Small and Rural Hospital Relief Program, and it is designated to help provide grant funding and collaborative design assistance to advance seismic compliance for small hospitals, rural hospitals, and critical access hospitals in California. The mission of the Small and Rural Hospital Relief Program is to support and enhance the effort of small, rural, and critical access hospitals to preserve access to general acute care for the communities they serve through the provision of state grant funding and technical assistance to advance building seismic safety and resiliency. So this program is administered through the Office of Health Facility Loan Insurance with technical support and assistance from the Office of Statewide Hospital Planning and Development, OSHPD. They are two distinct and separate offices within HCAI, but we work together on a number of different things, and we have come together to jointly administer this program. The Office of Health Facility Loan Insurance basically handles a lot of the paperwork and collection and administrative duties of running the grant program. And we also do kind of the financial analysis and accounting and bookkeeping and looking at the grant applications project financial feasibility and that sort of thing, while the seismic compliance unit looks at the specific construction projects and construction plans and make sure that that the project that is being proposed is meets the seismic compliance needs and requirements. Okay, so who can participate in this program? So a hospital needs to meet one of three general criteria. So the first one is the hospital needs to be designated as a small hospital. And the designation that HCAI uses is a hospital that has fewer than 50 beds. Or the hospital must be designated as a rural hospital as defined by HCAI's medical service study areas. And in our grant application process, in the eligibility process, you'll be able to figure out if your hospital is in this rural designated medical service study area. Or if your hospital is a CMS designated critical access hospital, you are also meet the eligibility criteria. Lastly, the statutes state that a hospital must indicate that seismic compliance imposes a burden that could result in the loss of services for a community. So what the intent there is, if the cost to do the seismic compliance work would be too great to where the hospital would close, and then there would be a lack of services in the community as a result of that closure, that would be a qualifying event for grant funding. With that, I will turn things over to Ali Sumer, who will talk about how the program works and how the collaborative process works.
Thank you. JP mentioned small or rural or critical access hospitals can participate. So a lot of times in these small rural critical access hospitals, they're not sure where to start. They don't have all the resources compared to the big chains. So it's a bit difficult process to think through how to get to the finish line. So this small rural hospital program, we tailored it such a way that we are not only looking at the usual project stuff, but we are also actively helping the hospital management to basically walk through this process together. So once the hospital participates in this program, and Carl will mention how each steps are after my few slides. Once you are in this program, you are assigned, the facility is assigned a liaison from seismic compliance unit. So that liaison is senior structural engineer, and that person is basically engages with the facility. Overall, the liaison looks at, okay, what are the ways to minimize the scope and the cost for each project package. Again, we are looking at seismic compliance projects, not only just giving grant, but also reducing the scope so that it's the most cost effective. Next slide, please. So what are the details of the collaborative environment and assistance? So again, unlike a typical project in HCAI, this is more hands-on, more collaborative. So first of all, seismic compliance unit, not only the structural engineers, but many members, we explain the process. a lot of people don't know all the steps, so we basically sit down with you, we explain everything. Now, with that, we also help you identify the seismic compliance scope. Some facilities come with consultants who are very familiar, some don't come with consultants, so we start with the facility. And then once many players start coming in, we also help coordinating and communicating between parties. So we are not project managers, but we are really keeping a close eye on what's happening around this seismic compliance scope. So once the seismic compliance projects started coming in or feasibility studies are being done, we our involvement is, again, early on, we provide recommendations on, okay, if you do that, that's kind of satisfies the minimum required scope. That also helps reduce the unnecessary or very, very conservative seismic scope. For example, again, we had several examples about material testing. There might be 70, 75 sample locations that was proposed. We look at it like just a few weeks ago, an example, 75 sample tests got reduced down to 12. So that's a huge savings on the cost of construction. But since we are involved in the early stages, we reduce the cost. Again, we explain this interactive process to the consultants. At first, they are surprised, like why we are pushing back on more than required number of samples. And once we explain the process, all of them so far embrace the idea, and they're more interactive with us. Again, it's not just material testing, the retrofit and PC, so everything about seismic compliance. So once the scope is dialed in, it needs to go to our regular region channels to get the permit. So we are also involved in that. We either act as the reviewer or we are the secondary reviewer at the region to make sure that things are going through the way that it was intended. So again, in all of these processes, we also help the facility to shape the grant application such a way that the CalMortgage team can take it and basically make a decision. So we really prepare the facility for success and get rid of all the unnecessary stuff. And if the grant program goes through, we also continue to support the facility and the design professional during construction as well. Things come up, new things get, there are surprises, whatever. So we stay with the facility all the way to the end. What are the eligible projects in this whole process that I explained? So this kind of gives the details. It's really three bins. One, the evaluation and pre-design. Two is the design phase activities, and the third one is the construction phase. The evaluation and pre-design is about material testings that basically looks at the building condition. So an engineer and design professionals, before they make any suggestions on how to improve the building, they look at the condition of the building. So there are two projects, material testing program, and once the project is done, the results of that. So those two projects are eligible for the grant application, as well as the seismic retrofit upgrade project, which is a SPC 4D. So if you have an SPC 1 or SPC 2 building and you want to upgrade it to 4D, that's an eligible project. NPC evaluation reports those are also eligible, and some feasibility studies that looks at many different aspects of seismic compliance. Those are the pre-design, what we call pre-design and evaluation stage. The second stage is once we agree on the scope of retrofit, the next phase is the construction drawings. So that includes structural, architectural, mechanical drawings, and that basically to make the construction work. And the third one is obviously the construction phase. Again, that phase is also eligible. The next slide, please. So what are the not eligible projects? Basically, any scope that is not related to seismic compliance is not eligible. So one common example or one common occurrence is, let's say you have an MRI room and you are upgrading one of the structural walls that happen to be in the MRI room. So you need to basically disrupt some operations there. And a lot of times facilities say, well, while I'm on that one, I always wanted to like find time and crew to replace the MRI machine because it's at the same time. It's the perfect time to do it. Well, if you include the MRI cost into the project, we want you to separate that upgrade to a separate project than the seismic compliance project, so that things are separated. We're not saying don't do it at the same time. It's more cost effective to do it at the same time. We want you to separate it so that the cost related to the seismic compliance is separated from those tenant improvement upgrades. So so that split is important. And we will help you also to make that decision about how to approach, how to separate things. Some things that have to be done, we understand that, again, case by case. So with that, I'm gonna turn to Carl, and he's gonna talk about how the whole process works.
Thank you, Ali. So we've heard what the program is and the sort of work that the program is to cover. So now we'll talk about how you enter the program. There are two phases, two steps to the first phase of this. Phase one is entry to the program. Phase two is the grant application, which JP will talk about after this portion of the presentation. So to start your engagement, apply for program participation. Applications are submitted through HCAI's electronic services portal to create an HRPE project application. You would use the normal process to access the, and I'm not sure that that URL is current, so my apologies on that. I believe it's esphcai.ca.gov, and we will correct that. But you enter your project as you normally would. However, when you come to the eServices portal, you'll see across the top that there are 5 links. Normally, you would enter your project work using the project link. However, in this case, you would use the small and rural hospital link, which would set you into the path for the HRPE type application. Let's go on, please. So, along with the HRPE, the program also requires that there be an updated seismic compliance plan. As you know, the seismic compliance plans were first created under Senate Bill 1953, way back 30 years ago, and that most of the applications for seismic compliance plan on file with HCAI are submitted around the 2006 timeframe. So it's necessary for there to be an updated seismic compliance plan. Now, the plan serves as a hospital's roadmap for their overall compliance effort. What you are going to do, when you are going to do it, what the intended results are. The contents for the plan have been simplified from what was adopted under Senate Bill 1953 and can currently be found in our PIN 71. And you see the header here for PIN 71 adopted last year. Next slide, please. We have that link. So what's in the compliance plan? Now, we said that it's simplified from the past, and it really is. The submissions that we've received so far that have been conforming typically amount to not more than 6 pages. So when you see how much content goes into 6 pages, you'll see that it's not that complicated. We start with a cover sheet showing the facility name, facility ID number, and the document title. We're looking for a brief narrative of current compliance status. Not more than 2 or 3 sentences are really necessary to describe what that current status is. We're also looking to see a graphic copy of the current key plan on that so that it would correlate directly to the compliance status, as noted here with number 2, and the existing building matrix under number 4. And of course, the existing building matrix can be found on the facility detail page for each facility in the state. We're looking for a brief narrative that describes the compliance effort. How is the facility going to approach SPC? Are they going to retrofit existing buildings? Will there be new construction? Will there be relocation of services from non-conforming to existing conforming buildings? And then the approach to NPC. This would be a very brief statement on how you're approaching your evaluation that's due by the end of this year as it relates to NPC 3, 4, NPC 4D, and NPC 5. And then another graphic showing the future compliant campus key plan once all of the work has been completed. Next slide, please. The 7th item then is the future building status matrix showing what the anticipated outcome is for each one of the buildings, SPC 3, 4, 4D, and 5, or the equivalent NPC. Now, we're also looking for a schedule of key activities, and I mentioned up front that this is a roadmap, so we're not looking for a great deal of specificity here, and most of what we received so far indicates that a particular action is going to happen within a calendar quarter rather than by a specific date. The purpose of the schedule is not to pin you down necessarily to a date, but to let us know in general that you're on track to provide particular submissions and that they fit within the framework of the 2030 compliance deadline. So we're looking for SPC 4D retrofit schemes or any other approach to SPC improvement. When the evaluations are due, we're looking for planned submission and review dates once all of those evaluations have taken place. And we're also looking for the anticipated construction start date and a completion date, with the understanding that all work must be completed by January 1st of 2030. Now, the PIN 71 also provides an Appendix A that allows the provider to list the services by building. However, next slide, please, that with adoption of Assembly Bill 1882, all hospitals are now required to submit their services on a per building basis as described here in the Hospital Services Reporting Guide, Section 5. So again, the link here will take you to that guide, and it would be better, quite frankly, to submit the GAC serve application than to attach Appendix A now that we have this up and running to avoid duplication of effort. Now, before we go on, though, I want to note that, as JP mentioned earlier, and I believe that Ali reinforced, our client in this case is the hospital rather than the design professionals. So our accountability here is directly to the hospital. Once the seismic compliance plan has been reviewed and accepted, our team then meets with the CEO and their design professional team to review this, to understand what the expectations are, and to ensure the client where we are ready to give the support that Ali described. Next slide, please. So, qualifications are reviewed in phase 1, step 1, not complete until the plan has been approved. Once that has been approved, the hospital and their design professionals are then ready to receive the technical assistance that Ali described. So with that then, and with a qualifying project, we now go back to JP to discuss the grant issuance process.
All right, thank you, Carl. So now we're at this point. You've been on the e-services portal, and you've submitted a seismic compliance plan to Carl and Ali's team, and you've done the program eligibility tool, and learned that you fall within one of the 3 eligibility criteria, and you've received an official letter of eligibility authorizing you to apply for an SRHRP grant. So what you do from here is, as I've said, we will then you'll submit a grant application through an online tool, which I will show you in just a second, and then that will get reviewed by HCAI staff, and we will then determine grant awards. So where you go to apply, probably the easiest way to do it is to just go directly to this website, funding.hci.ca.gov. And at the top is a place for you to log in or create an account. If your hospital has possibly been through the process of applying for a grant with our workforce division, you may already have an account. But if you don't personally have an account, it's really easy to set one up. You click create an account and you set up your profile. And what's really important, whether you have an existing profile or not, but within your profile, when you're setting it up, make sure you check this box right here that's circled in red. It says Organization for Seismic Construction Funding. Check that box and then click Submit. You'll then be able to see this page here, which authorizes you to apply for the Small and Rural Hospital Relief Program. You click this link, and then you will have access to click this Apply button. As soon as you click that Apply button, you're going to be brought into the actual grant application. And it's basically like any sort of other forms you've filled out online. It will ask you for some contact information. It will ask you for that important HRPE number that Carl and Ali mentioned. You'll also have an SCR number, which is your seismic compliance project number that you'll need to enter in. And it will ask you a series of questions about the project, what you're going to be spending the money on, what are the sources and uses of the project, and it will ask you for some documents that you will need to upload, like a budget and some financial statements and things like that you'll need to submit. You go through the process and fill that out, and when you click submit, it will get submitted to HCAI staff to review, and we review these quarterly, and we look at the overall program eligibility, the community need aspects, the financial plan to complete the project. The seismic compliance unit looks at the project appropriateness to meet the seismic compliance, what are the project costs, and project readiness plays a big role as well. Like, how ready are you to pull the trigger on this project? Is it something that's 6 months away, or is it ready now? That will kind of help to determine if you are eligible for an award, when we can fund that award. And we determine the awards based on the scores from these factors, and we determine the size based on the funding that we have available on hand. And I'll get more into that in a future slide. The seismic compliance unit will also look at the project milestones that must be achieved to receive the awards. So typically, if it's going to be a project possibly involving construction that's going to take months or even years to complete, you may not get your full grant award on day one. It may be a situation where there's a 25% milestone that you must achieve, and then we can release a portion of the grant awards, that sort of thing. So the project milestones will be developed, and then we will circulate the award notices and all of the grant agreements and various state forms and paperwork that need to be executed to receive the grant. So what's next for the program? So I mentioned funding. So originally, as I discussed at the beginning, this was funded through an excise tax on e-cigarettes, and unfortunately, the estimates and forecasts for those tax revenues are a lot less than what we would like. But the forecasts are that we will have about 2.6 to 3 million bucks a year through that excise tax to be able to grant out towards various seismic projects. So obviously, we're not going to be able to fund entire large construction projects, but maybe we can help out with some of those design costs or those seismic evaluations that need to happen at the beginning. The applications are currently open now. Everyone can go in and start filling out an application. They're being accepted on an ongoing basis. And we anticipate that the award notices for the first handful of awardees that have already applied to date will be going out shortly. Future awards will be made on a quarterly cycle, so we'll be looking at the next round of awards right after the first of the year. And we are currently in the process of automating our award documentation process, so that way all of the paperwork and everything can be generated automatically through a system with all of the information, everything that you upload into the grant application. And the first handful of awardees will unfortunately have to go through kind of a manual process to execute and sign your paperwork. But in the future, this will all be handled electronically through Adobe Sign. And then lastly, related to funding, the 2023-2024 Budget Act designated one-time funding of an additional $50 million. That funding is coming from a managed care organization tax, which has yet to be collected and yet to be distributed to us. It's going to be probably, middle or end of first quarter to middle part of 2024 before we have access to that funding. So at this point in time, we're solely reliant on the grants from the e-cigarette excise tax, but we do have this $50 million on the horizon coming, and we are currently meeting and discussing proposals for the best way to leverage that $50 million and make it go, stretch it as far as possible for small and rural hospitals that need to do work to meet seismic compliance. So with that basically concludes our webinar. We do not have a Q&A session planned, but we encourage you to please go to the program website. There's a lot of information on there, links to where you can check that eligibility and access the e-services portal to get that process started for submitting your seismic compliance plan, or apply for the grant application. There's also a grant guide that walks you through the grant application process. At the end, there's information about our scoring criteria and everything like that. So please check out that website. And then questions that you have from this presentation, please submit them to our email account about the program, SRHRP at HCAI.ca.gov. And we'll leave this up here for a couple minutes. That goes to an inbox that a number of people are monitoring, and we will get your question, whether it's about the application process or whether it's a specific seismic question. We'll get that routed to the right place for you. Lastly, if you want to speak with a live person, if you want to speak with me, feel free to call this number, and we'll get you connected and helped out. Thank you, everyone. We'll leave this slide up for a couple minutes, but appreciate your time and giving us the opportunity to walk you through this information.